5 essential nighttime habits for people with diabetes. Did you know that your pre-bedtime routine can significantly impact your blood sugar levels overnight? Many individuals unknowingly contribute to fluctuations in their blood sugar levels, potentially jeopardizing their health. Don't let this happen to you. Managing diabetes effectively involves not only dietary choices and physical activity during the day, but also establishing healthy nighttime habits. If you experience unpredictable blood sugar levels upon waking, it might be time to reassess your evening routine. This video will unveil the top 5 nighttime habits that every diabetic should adopt to maintain control and wake up feeling refreshed. Stay tuned, as these tips could revolutionize your sleep and overall well-being. 1. Choose the right evening snack. Maintaining stable blood sugar levels overnight is crucial for overall health. While you sleep, your body continues to process glucose and maintain energy balance. Consuming the right type of snacks can help minimize significant fluctuations in blood sugar levels, both increases and decreases. This, in turn, can contribute to better sleep quality by preventing nighttime awakenings due to low blood sugar or excessive thirst caused by high blood sugar. Additionally, stabilizing blood sugar levels can help prevent the Somogyi effect and dawn phenomenon. The Somogyi effect occurs when low blood sugar levels during the night trigger the release of hormones that increase blood sugar, leading to high blood sugar upon waking. The dawn phenomenon refers to the body's natural release of glucose into the bloodstream in the morning, which can cause elevated blood sugar levels. An ideal bedtime snack should be low in carbohydrates to minimize the risk of blood sugar spikes. Refined carbohydrates, such as white bread and cookies, cause rapid increases in blood sugar, followed by a quick drop. A snack rich in protein is beneficial, as protein digests slowly, providing a steady release of energy into the bloodstream. This helps maintain stable glucose levels throughout the night. Fiber also plays a crucial role in slowing down carbohydrate digestion, promoting a feeling of fullness and preventing nighttime hunger. Healthy fats, such as those found in avocados, olive oil, and nuts, slow down glucose absorption, preventing sudden blood sugar surges. Choosing the right bedtime snack is a small habit that can have a big impact on people with diabetes. It not only helps manage blood sugar levels, but also improves sleep quality and overall health. 2. Maintain a consistent sleep schedule. A consistent sleep schedule is crucial for individuals with diabetes because it plays a vital role in regulating blood sugar levels. Adequate sleep helps maintain a balance of hormones like insulin and cortisol. Insulin assists cells in absorbing glucose, keeping blood sugar stable. Cortisol, a stress hormone, can lead to elevated blood sugar levels when excessive due to sleep deprivation. Sufficient sleep enhances the body's ability to utilize insulin, leading to better blood sugar control. Conversely, sleep deprivation can decrease insulin sensitivity, increasing the risk of high blood sugar and insulin resistance. Insufficient or irregular sleep can have negative consequences, including increased cravings for sugary and starchy foods, weight gain, and worsening insulin resistance. Research has shown that sleep deprivation increases the risk of developing diabetes complications. Maintaining stable blood sugar levels. A regular sleep schedule can help reduce sudden fluctuations in blood sugar levels. This enhances your body's ability to regulate glucose overnight. Boosting overall health. Deep sleep allows your body to repair and rejuvenate, which is especially important for people with diabetes who are more susceptible to blood vessel and nerve damage. Supporting other healthy habits. Getting enough sleep improves mood, reduces stress, and increases motivation to maintain good habits like healthy eating and exercise. A consistent sleep schedule is crucial for maintaining good health. When you don't get enough sleep, your body produces more cortisol, which can lead to insulin resistance and higher blood sugar levels. Sleep deprivation also increases the hormone ghrelin, which makes you feel hungry, and decreases leptin, which controls feelings of fullness. This can lead to overeating, especially of unhealthy foods. Inconsistent sleep patterns can also contribute to weight gain, which can worsen diabetes. Finally, poor sleep weakens your immune system and makes you more susceptible to inflammation, increasing the risk of cardiovascular and neurological complications. Maintaining a consistent sleep schedule is a crucial habit for managing blood sugar levels and improving overall health in individuals with diabetes. Regular sleep not only enhances insulin sensitivity, but also helps reduce stress, improve mood, and support other healthy habits. This seemingly small change can have a significant long-term impact on your quality of life. 3. Limit screen time before bed. Reducing screen time is crucial for individuals with diabetes. Blue light emitted from electronic devices like phones, tablets, and TVs disrupts melatonin production. Melatonin is a hormone that signals the body to rest and prepare for deep sleep. When melatonin is suppressed, it becomes harder to fall asleep, and sleep quality deteriorates. Poor sleep affects blood sugar levels. Sleep deprivation increases cortisol, a stress hormone, leading to elevated blood sugar. Lack of sleep or insufficient deep sleep reduces insulin sensitivity, making it difficult for the body to regulate blood sugar. Excessive use of electronic devices before bedtime, such as browsing social media, reading news, or working, can stimulate the brain, making it difficult to relax. Mental stress can also contribute to increased blood sugar levels. Reducing screen time before bed offers several benefits for your health and well-being. Firstly, it improves sleep quality. By limiting screen time, your body naturally produces more melatonin, a hormone that helps regulate sleep cycles, making it easier to fall asleep. Better sleep also helps your body regulate blood sugar levels throughout the night. Secondly, it helps stabilize blood sugar levels. Deep and restful sleep reduces the risk of nighttime blood sugar spikes and the Somogyi effect, or dawn phenomenon. Finally, reducing screen time before bed helps reduce stress and anxiety. Giving your brain time to unwind before sleep helps prevent unnecessary stress and promotes relaxation. The consequences of not reducing screen time before bed include disrupted sleep, increased stress and blood sugar levels, and the development of unhealthy habits. Blue light emitted from electronic devices can make it difficult to fall asleep or achieve deep sleep. Insufficient or poor sleep quality can increase the risk of elevated blood sugar levels at night. Scrolling through social media or working late can stress the brain, negatively impacting blood sugar levels. Using devices before bed can easily become a habit that is difficult to break, reducing the effectiveness of other diabetes management strategies. The long-term benefits of putting down your devices before bed include improved sleep quality, enhanced mental health, and support for other healthy habits. Quality sleep allows your body to recover, improves insulin utilization, and stabilizes blood sugar levels. Unplugging from technology provides time for relaxation, which can reduce stress and anxiety, leading to a better mood. A good night's sleep gives you the energy to maintain positive habits like exercise and healthy eating. Reducing screen time before bed is a small change that can have a big impact on people with diabetes. This habit not only improves sleep, but also helps manage blood sugar levels, reduce stress, and enhance overall quality of life. Taking it one step at a time and being consistent will help you achieve lasting positive results. 4. Stay hydrated the right way. Staying hydrated is crucial for individuals with diabetes. Water plays a vital role in regulating blood sugar levels by diluting glucose in the bloodstream, aiding in blood sugar control. The body utilizes water to eliminate excess sugar through urine. Adequate water intake also supports kidney function, which is essential for removing excess sugar from the blood. This helps prevent diabetes-related complications such as kidney failure. People with diabetes are more prone to dehydration due to high blood sugar levels, leading to increased urination. Dehydration can further elevate blood glucose levels, posing a health risk. Drinking water properly in the evening offers several benefits. Maintaining stable blood sugar levels overnight. Adequate hydration helps your body maintain metabolism and blood glucose balance while you sleep. Avoiding sleep disruptions. Consuming excessive water right before bed can lead to frequent bathroom trips, disrupting your sleep and affecting blood sugar levels. Preventing dehydration symptoms. Dehydration at night can cause dry mouth, thirst, or fatigue upon waking. Drinking the wrong amount of water can have several negative effects on your health. Drinking too little water during the day can lead to dehydration, increased blood sugar levels, and put extra strain on your kidneys. You may also experience dry mouth or thirst at night, which can be uncomfortable and disrupt your sleep. On the other hand, drinking too much water before bed can increase the frequency of nighttime urination, interrupting your deep sleep. Insufficient or poor quality sleep can lead to increased cortisol levels, which in turn can raise your blood sugar. Drinking water properly offers long-term benefits. It can help manage blood sugar levels, which is especially important for people with diabetes. It also supports kidney health, reducing the risk of complications like kidney failure or diabetic ketoacidosis, DKA. Furthermore, drinking water at the right times can improve sleep quality, allowing your body to fully recover. A well-structured hydration plan involves consistent water intake throughout the day, divided into multiple sessions. It's advisable to limit sugary beverages like soda and overly sweetened juices. In the evening, enjoy a glass of water before dinner. Avoid excessive water consumption within 1 to 2 hours before bedtime. Before retiring for the night, a small sip of warm water can help promote comfort. Drinking water properly is a simple habit that offers numerous benefits for individuals with diabetes. It helps maintain stable blood sugar levels, improves kidney function, and ensures uninterrupted sleep. It is crucial to consume adequate water throughout the day and limit water intake before bedtime to avoid negative impacts on sleep and overall health. 5. Monitor blood sugar levels before bed. Checking your blood sugar before bed is crucial for people with diabetes. This helps predict and prevent overnight blood sugar fluctuations, which can lead to hypoglycemia, low blood sugar. This can be dangerous as your brain needs glucose to function properly. Hyperglycemia, high blood sugar. This can cause fatigue or increase the risk of long-term complications. By checking your blood sugar before bed, you can make timely adjustments to your diet or medication. If your blood sugar is low, you can have a small snack to raise it. If your blood sugar is high, you can adjust your insulin dosage if instructed by your doctor. Stable blood sugar levels also contribute to better sleep and overall health. You'll be able to sleep soundly throughout the night without waking up due to symptoms like thirst, frequent urination, or tremors. Checking your blood sugar before bed offers several benefits in preventing nocturnal hypoglycemia, also known as nighttime low blood sugar. Nocturnal hypoglycemia can occur due to overdosing on insulin or oral diabetes medications, insufficient carbohydrate intake during dinner or after physical activity. Symptoms of low blood sugar include sweating, trembling, rapid heartbeat, and even loss of consciousness. Checking your blood sugar before bed allows you to promptly address any potential issues by having a snack if necessary, reducing the risk of these symptoms. Monitoring your blood sugar before bed also helps to minimize the risk of early morning high blood sugar, a phenomenon known as the dawn phenomenon. This occurs when your body naturally releases hormones like cortisol and glucagon in the early morning, leading to an increase in blood sugar levels. By checking your blood sugar before bed, you can anticipate this rise and adjust your insulin dosage or snack choices accordingly. Regular blood sugar monitoring before bed contributes to better long-term blood sugar control. It helps you and your doctor understand your individual blood sugar patterns, allowing for optimized treatment plans. Before you drift off to sleep, it's essential to check your blood sugar levels to ensure a restful and healthy night. Here's a comprehensive guide to help you effectively monitor your blood sugar before bedtime. Utilizing a personal blood glucose meter. A reliable blood glucose meter or continuous glucose monitor, CGM, is your primary tool for accurate readings. Ensure your hands are clean and dry before testing to avoid inaccurate results. Understanding your target blood sugar range. Your ideal blood sugar level before sleep may vary depending on your individual needs and medical history. However, a general target range often falls between 110 to 150 milligrams per gillis, as recommended by many healthcare professionals. Consult your doctor to determine your personalized target range. Taking action based on your readings. Low blood sugar hypoglycemia. If your blood sugar dips below 70 milligrams per hour, consume a light snack containing complex carbohydrates and protein, such as whole grain toast with peanut butter. This will help stabilize your blood sugar levels. High blood sugar, hyperglycemia. If your blood sugar exceeds 200 milligrams per deciliter, follow your doctor's instructions. You may need to adjust your insulin dosage or make changes to your bedtime routine. Maintaining a record of your readings. Keep a log of your blood sugar levels to track trends over time and discuss them with your doctor. This information will help you and your healthcare provider make informed decisions about your diabetes management. Failing to check your blood sugar before bed can have serious consequences. Uncontrolled high or low blood sugar levels can lead to complications. Without knowing your blood sugar levels, you may miss the opportunity to intervene in a timely manner. Severe nighttime hypoglycemia can cause seizures or loss of consciousness. Fluctuating blood sugar levels can disrupt your sleep. Symptoms such as thirst, frequent urination, or sweating can wake you up in the middle of the night, reducing the quality of your sleep. Long-term complications can arise from unchecked and unmanaged blood sugar levels. These include damage to your eyes, nerves, or cardiovascular system. These 5 nighttime habits can significantly impact the lives of individuals with diabetes. By making small adjustments to your evening routine, you can experience notable improvements in blood sugar control, energy levels, and overall well-being. Which of these habits will you incorporate into your evening routine tonight? We encourage you to share your thoughts in the comments below. Remember to like this video and subscribe to our channel for more insightful tips on effectively managing diabetes. Your support motivates us to continue providing valuable advice for a healthier and happier life. Stay healthy, stay informed, and we look forward to seeing you in our next video.